I'm Beth Kirago. I'm a nurse midwife working at Jacaranda Maternity. I'm here today so that we can discuss about the first clinic and the common myths in pregnancy. Mostly when I say the first clinic, what comes to your mind? The first clinic. When should you start your first clinic? In fact, you should start your antenatal clinic immediately you know that you're pregnant, or you suspect that you might be pregnant, or immediately you miss your monthly period. You should come and check whether you're pregnant or not. So you start your clinic immediately you suspect that you're clinic. And what is expected of you as you come to the clinic? You come, you register at Jacaranda Maternity, then we run a series of tests to determine that whether you are pregnant or not. Like we will do the scan, the first scan from conception until week 13, that is the dating scan, to confirm that you are pregnant. This scan should show us that there is a heartbeat of the baby, and it should also estimate the gestational age or the age of this pregnancy. Maybe it is 8 weeks or 10 weeks. The scan should tell us how old is the pregnancy. We also run a series of tests of blood and urine, where we check on your blood level, we check on your blood sugar. We also screen you against the sexual transmitted infections like hepatitis B and syphilis, which are dangerous infections in pregnancy. We also check whether you are HIV positive or negative, and then we advise you accordingly. HIV, you do it at a consent. You consent first, then we do the HIV testing, so that to know to differentiate between the risky pregnancies early as we continue journeying together. Okay, we also get a chance to teach you a bit of nutrition, and we also teach you about the danger signs in pregnancy. Danger signs in pregnancy such as severe abdominal pain, severe headache, edema of the lower lips and the face, blood vision, any bleeding or spotting in pregnancy. All those danger signs should be learned in the first antenatal clinic, so that you can be able to know when your pregnancy is at risk. In fact, if you have any danger signs in pregnancy, it puts you into greater risk of pregnancy. Okay, what else do we do when you come to the clinic? Other than the test, the health education, we also do a physical exam, head to toe exam, to see whether you're physically stable for this pregnancy. We also check your vital signs. Vital signs include the blood pressure. The normal blood pressure should be around 130 systolic and 80 the diastolic, not higher than that. We also check on your body weight. Your body weight, we continue checking your body weight after every visit, that is monthly, to see your increment. How are you increasing in your body weight? In pregnancy, you should add at least 10 to 15 kgs throughout until your term. That is the normal weight gain in pregnancy. There are those who will not gain weight, and there are those who will excessively gain weight. Losing weight in pregnancy, especially we expect it in first trimester, but we don't expect it to lose weight once you get into the second trimester. So we have said that the maximum weight, the level of the weight that you should gain during your pregnancy period is between 10 to 15 kg. Bearing in mind that there are those who will add more and there are those who will add less than that. That's why we encourage monthly visits of the antenatal clinic, so that we can monitor you. How are you gaining your weight as well? So we also check your temperature to see whether you have fever, you have any sign of infection. So we also screen you for urine check. Every visit you come, we screen you for urine analysis. Then we check whether the urine is concentrated. Is it clear? Does it have any sign of infection, or is it infected already? If it is infected, we treat that infection. If it is not infected but it's not clear, we still guide you on how to make it clear through hydration. And how much water should you take when you're pregnant? At least 8 glasses. If you can be able to increase between 2 liters to 3 liters, the better. In pregnancy, you'll find in pregnancy, you'll need that water to hydrate your brain, to keep you well hydrated so that even the baby can get enough of this. Remember, our babies will always feed on what you are taking. They will feed on what you are taking. About nutrition in pregnancy, you will hear nurses in the outpatient clinic telling you if you have been taking 3 main meals, now we increase it to 4 main meals. It is not that you are eating for the two, it is because now your body is compensating for an extra person who is inside you who needs you. So we increase that to from 3 main meals to 4 main meals. We recommend rehydrating at least 2 to 3 liters in every 24 hours. Okay, you can continue with normal exercises in pregnancy. Normal exercises, the exercises that are not extraneous, they are just normal to your level. Not gym. We don't recommend you to start doing the gym exercises, lifting heavy objects, but normal things. Just like walking, you can wash clothes, you can go to your kitchen and cook. You can go and hang clothes upstairs. You continue doing your job. You go to work and come in the evening as usual. Yeah, another question I have. Why is the first visit so important? I think I have already tackled that. The importance of the first visit, it's because we run around a series of tests. We'll teach you about teacher science, we'll do physical exam, we'll confirm that you are pregnant through doing an ultrasound or an obstetrics can continue to confirm that you are pregnant. So that is the why we call the first visit so important, because we'll screen you. Can I skip visits if I feel fine? No, you should not skip visits if you feel fine. We have said that every visit counts. Every visit you come, it counts, because we continue monitoring you every visit, and we do this according to the WHO, World Health Organization recommends that antenatal clinic should be done monthly, not like the way they used to be done 4 times until your pregnancy journey is done. Now we are doing it after every month according to the World Health Organization to assess how good you are, how your pregnancy journey is, and if there is any danger sign, we can be able to know early enough, and we can intervene, and or we can sort it out early enough before things get worse. Nowadays, antenatal clinics are done after every month. We also get a chance to see you more closely, more often. We also get time to check your weight every month, which is very important in pregnancy. About common myths about pregnancy, there are myths I know. Like here, somebody who is asking, is it time I should eat for two? About eating for two, you have said it's a myth, but we recommend you increase your meal from 3 main meals to 4 main meals. That is one extra meal, because there is a compensation. There is somebody else who is compensating for what you are getting. So we increase it to just one. Not you cannot double to 6 main meals. So can stress harm my baby during pregnancy? Stress can harm your baby, but it depends with the level of stress. If you feel that you are stressed enough, we should come, we check on you. Then we advise you accordingly, because we have minimal stress and excessive stress. Excessive stress can cause harm to your baby. Is morning sickness only in the morning? It is a myth. All those are myths. They are just called morning sickness because mostly after you conceive, there is shifting of the pregnancy hormone. That is the progesterone hormone. They tend to get high, and in most cases, they cause irritation to the brain. So there are those who will wake up in the morning and they feel like puking. There are those who will wake up very stable. So all those are myths in pregnancy. So another question that many has been asking, can I exercise during pregnancy? Can I exercise during pregnancy? We have said exercises continue throughout the pregnancy journey as long as they are not the extraneous exercise, just normal exercise like walking, washing, going to job, coming back. Okay. Is it true I can't dye my hair while pregnant? About dyeing, we have said that we use dye that has no heavy metals like lead or mercury. There are those soft dyes. You check on the content. You need to use the dyes that have high metals like mercury. Yeah, those ones are very safe. And they are always the American made guys. Can I exercise? That one I have answered. Is morning sickness? Is morning sickness only in the morning? No, not only in the morning. Sometimes you tend to feel bad when the progesterone is high. Mostly it is high in the morning upon waking up. But you can. Is morning sickness only in the morning? No, not only in the morning. Sometimes you tend to feel. Okay, I was about the morning sickness. Is it only in the morning? It might not be only in the morning. It is according to the shifting of the progesterone hormone. There are those who get pregnant and their progesterone hormone tends to be high in the evening, so they might feel the urge to puke or the nausea. It can even come in the morning or in the afternoon or even in the middle of the night. Which matters. So I'll continue answering questions as you have asked them. There's somebody who has asked about 3 months pregnant. What can I take for the vomiting? Somebody who is in 3 months expect vomiting, especially in the first trimester. First trimester is from conception to week 13. So there's somebody who is asking what you can take when you feel like vomiting. You come for assessment first. We check if you have severe vomiting. It becomes a danger sign in pregnancy. So if you're vomiting everything that you eat, it is a danger sign. If you're not vomiting everything, you come, we check, we analyze you, and then we can give you a supplement. We can decide to give you the either maybe odacentron or classes or a subvit, a combination of folic according to the level of vomiting. If you come, we assess you, it will be better because we'll also assess whether you are dehydrated. What can I take to reduce heartburn? Heartburn at first. What causes heartburn in pregnancy? Remember, we have this shifting of the pregnancy hormones that leads to heartburn. Also, in that trimester, the position where the stomach is just behind the left breast. The stomach gets to be compressed during pregnancy because the belly goes outwards. So the stomach is pushed upwards, and there is a reflux that is triggered automatically to cause the heartburn. Sometimes even it causes even difficulty sleeping. We recommend to reduce heartburn. First, try take small meals but frequent. You can even decide to take after every 2 hours you eat small meals but frequent, so that you can give that food time to digest. But if it is severe, you can recommend antacids. We prescribe them if it is severe. And we also recommend you reduce the citric acid fruits like oranges that are high in citrus or acidic. You try to reduce all acidic fruits and foods. My baby is in breech, that's 6 weeks. Is it risky? It is not risky, but it might be difficult for your baby to have turned by the time of birth. So if you know that your baby is breech at that 6 weeks, nowadays we are not attempting normal delivery when the baby is not in cephalic. If the baby is still seated, you come for assessment. Then we plan for the mode of delivery best for you according to your to the lying of the baby from week 39 weeks. Maybe the baby might have turned by week 39. In fact, if we plan for a cesarean section delivery, in that morning of delivery, we confirm that the baby is still in breech. If the baby has turned, we can plan for induction or we give you some more weeks to wait, as long as the baby has turned from week 39. If at week 39 the baby is still in breech, we recommend to do a cesarean delivery. But you are not in risk because there's nothing you can do when the baby is in breech unless we give the baby time either to turn or to still remain in breech, but we plan for the best safe method to deliver you. I'm 10 weeks pregnant, but my stomach hurts. Should I worry? Okay, which part of your stomach is hurting? That is my biggest question. Which part of your stomach? Maybe it is the lower abdomen. Severe abdominal pain in pregnancy is a danger sign. So I'll urge you to come for checkup. We assess why it hurts. Why is it hurting? Is it because is it a danger sign? Is there spotting? Or is there no spotting? Is it because you have taken acidic food or not? So you come for checkup. We rule out. What is the benefit of iron supplement? Must I take them? why do we start by asking ourselves, why do we give iron supplement in pregnancy? Remember, when immediately you conceive or when you are pregnant, your iron levels gets down. It will start getting down, especially when your iron levels was not good. That is was not above 12.5. Okay, we want your iron levels to be maintained throughout your pregnancy journey. The reason we take iron supplement is so that you can maintain your iron levels. Mhm. So continue asking questions which continue coming. Don't ask questions outside our topic. Which medication should I take at 4 months? Which medication? What do you mean? Which supplement? Supplement we give according to the level of iron that you had or that you have at the moment. Let's say like you have iron that is below 10. We recommend you to take iron with a combination of vitamin C because vitamin C will help in attracting the iron absorption. If your iron supplement is, your iron level is above 13, we will give just normal Pregnacare or Pregnacare Plus. Let's say your iron level is 15 and above. We'll give you an iron supplement that contains more vitamins because we don't want you to get the iron toxicity in your brain. Like we give, we have a supplement called, what do we call this supplement? Nutrimum. Nutrimum has got a lot of vitamins. So it depends with the level of your iron levels. Best way to shave during pregnancy. What is the best way to shave? Just the normal. There's no best way to shave. You can decide even not to. But we recommend you can shave the best you can, depending on your position, or your spouse can even help you out. Okay, after childbirth, how long does bleeding go? For that degree here. After you have delivered your baby, according to the World Health Organization, the bleeding should go from delivery to a maximum of 6 weeks, although there are those whose bleeding will stop by week 2 or by week 1. The reason we give you a day after delivery, you come day 10, we check on how you have been doing, which we assess your bleeding into bracket 30 degree tear. If you sustain the 30 degree tear, I'm very sure your midwife explain to you how you should be taking care of that tear. Just normal wash, then you splash it on clean warm water at least 3 times a day. You maintain hygiene on that tear. From there, we give you a day to come. That is day 10 from the day you have been discharged, so that you can check on how well you have been taking care of that tear. Have it healed? Mostly, it should have healed by day 10. Does sleeping on the right side affect the baby? Does sleeping on the right side affect the baby? So when you are in labor, are you in labor or not? When you can sleep on either side, right or left? Well, pregnant. But when you are in labor, we expect you to maintain left lateral. When you are on left, you get more oxygen to the baby according to our anatomy and physiology of our lungs. The right lung has got more lobes. That's why it contains more oxygen. The moment you breathe on your left, you breathe more oxygen than when you breathe on your left. So we can check the anatomy of our lungs. That's the assignment. You can check the anatomy of our lungs. The right lung has got 3 lobes and it has got the wider pipe, meaning it transmits more oxygen that you breathe in than the left. Elective CS is from how many weeks? Thank you. Elective CS. We book elective CS according to how many cesarean sections have you had previously. What is the reason for elective CS? There are those who will do elective CS at that 7 weeks plus few days because let's say they have multiple gestation, they have twin deliveries, and these twins are sharing like everything. They are sharing amniotic fluid, they are sharing the placenta. They are at high risk that one twin will be losing a lot of nutrients to the other. Like those ones we deliver them before week 38, but after week 7. Okay, there are those mothers who have delivered through cesarean section the first baby. Now they are delivering a second baby, but it is just an inventive pregnancy. There's no problem. We give them until week 39. Okay, There are those mothers who are delivering for a third baby. That is the third cesarean section. Those ones can be delivered at week 38. So it depends. It depends with your body, which number of pregnancy, how has been your pregnancy journey. So we don't compare this. We don't book just everybody. Elective yes, because it is elective, it is 38 or 39. It depends. Are they twin pregnancy? Say your first journey. How smooth has been your pregnancy journey? Another question, does 20 weeks scan give correct gender? 20 weeks scan that give correct gender. For me, I will not tell you 100% it will give you a correct gender, but I will recommend a good gender is a gender that the sonographer, the doctor who is doing that scan can also show you the sex organs. You check together, they should show you this is a baby boy or a baby girl. But at 20 weeks, this pregnant woman will not be able to tell this is a boy or a girl. So I will recommend the best gender is between week 24 to 28 weeks. That is according to my recommendation. When should I start? That one I answered. You start your antenatal clinic immediately you miss your period, or immediately you suspect that you might be pregnant. You start your antenatal clinic. That 7 weeks and baby is breached. Should I be worried? You should not be worried. You come to the hospital, we confirm that you are breached, and then we will guide you accordingly and we will plan how we will deliver you best. Must I take folic acid tablet when on the earlier stages of pregnancy? Yes, please ensure that you take folic acid during the first trimester. What does folic do to your body? Folic does not add iron, but it reduces the chances of abnormal formation of the fetus. Sawa. So ensure that you take folic. It will prevent the baby from abnormal formation like encephalitis, spinal. It prevents formation of spinal bifidus. So if you don't take the folic acid, you are putting your baby at high risk of abnormal fetal formation. Other questions? So keep the questions coming about mates and antenatal journey, mates in pregnancy, antenatal journey. Is there tablets that reduce salivation during pregnancy? There's somebody here who is salivating too much during pregnancy. Salivation during pregnancy, expect it is normal. Mostly we recommend you take the natural fruits. The natural fruits like watermelon, just more maembes, just fruits, normal sugars. Yeah, those one tend to reduce the salivation, but there are no medications recommended for that. I was diagnosed with H. pylori and have found out I am pregnant. Please help. If you have been diagnosed with H. pylori, have you been treated? That is my question. If you have not been treated, let the gynecologist or doctor who is seeing you during your antenatal clinic know that you have H. pylori. If you have been treated, you come for checkup. We see, because there are some of the H. pylori treatment, they are not safe in pregnancy. So you should tell us whether you have been treated or not. Is it okay to take painkillers for headaches while pregnant? In pregnancy, we recommend paracetamol only. We only recommend paracetamol tablets as a form of painkiller if you have headache, but you don't take them excessively, in moderation, because this headache, who told you that it is, it will be treated by painkillers. We said severe headache in pregnancy is a danger sign, so I still recommend you come, we assess the level of your headache. Maybe it is your blood pressure which has already spiked and you are here taking the painkiller. Painkiller will not reduce the blood pressure. So severe headache in pregnancy is a danger sign. Keep the questions coming. Keep them coming. Is it normal to have constipation 12 weeks after CS? If yes, for how long does it persist? 12 weeks post CS. Mostly after you have been through cesarean section, remember the body has to undergo the physiological changes. There are these changes that occur after you have conceived so that your system can be able to know that you are pregnant. There are other changes that occur immediately the baby is born. Remember, your blood system or your body system used to function for yourself and this unborn baby. No, this is another process that your body is undergoing after the baby has been born. The pumping, the digestion. So all these stages comes with a lot of. There are those which will come with issues like this mother who has been delivered through cesarean section. Now the baby is out. Okay, the bowel cells of this mother they are less active immediately after surgery, but by day 12 you should be regaining back to normal. So constipation will only come when you are not active, especially day 12 post surgery. But remember, there are these drugs that we discharge you with. If you delivered with us, we must have given you the lactose just to help to ease with your digestion. So you can get the answer is it is normal to get constipation, but I also feel the 12 post CS it is long way. By now you should not have been constipating. If you note that you have constipation, I'll not tell you to take lactose before we assess you, but I'd encourage you to take more water, then vegetables, fruits high in fiber, and then fruits, and then try to abilitate or to walk more. Walk, just walk up and down. Don't do extraneous exercise for CCS, but do normal exercises to relieve the constipation. If it is severe and you were discharged with lactose, take 1 spoon, the big spoon, 1 spoonful of lactose. If it does not resolve, you come for checkup. We check whether the bowel cells are okay. Okay. By how long does it persist? By now, constipation you should be away from constipation. Is pelvic pain normal at that 2 weeks? Why pelvic pain at that 2 weeks? That 2 weeks, this baby is still premature. You don't expect this baby to be born by now. So if you feel pelvic pain, it means mostly your calcium levels are low. Ensure that you are taking calcium in pregnancy. Don't take painkillers for pelvic pain because pelvic pain can be chronic. Mostly it is because the baby has turned. The head is just in the pelvic canal or the pelvic bone. So your pelvic now is training to hold this baby and maybe your calcium is already low. Any hip pain or pelvic pain in pregnancy, mostly check your calcium levels, or if you don't, why ensure that you are on calcium supplements. Okay. Is it wrong to take pineapple and pawpaw while pregnant? It is not wrong to take pineapple. It is okay because it is a fruit. As long as you have been done the glucose test and the readings are normal, you can just take as much fruits as you can. But if you did the OGTT test, that is a glucose test, and we are told that your sugar levels are high, you take pineapples in moderation. So there is nowhere documented that pineapple will trigger labor. Okay. Is it true I have heartburn? It means my baby will have a lot of hair. Those are myths. Those are common myths in pregnancy. Those are common myths. It's not true that now that you have heartburn that your baby will have a lot of hair. Your baby may not even have hair. Those are myths. Eating spicy food until will make my baby short-tempered. All those are myths in pregnancy. They are nowhere documented in the medicine. Is it true that my cravings determine my baby's gender? All those are myths in pregnancy. All those are myths in pregnancy. Is it true that I should only do anal sex so as not harm the baby? No. No, in fact, anal sex is prohibited and it is not acceptable at all. There's nowhere that is documented. You just continue with your normal sex. It will not harm the baby because the baby is already surrounded by amniotic sac and has amniotic fluid in it. So there's no barrier between the outside and the baby. Eating pineapple can trigger labor. That one is a myth. Okay. I'm craving a lot of bananas. Does that mean I am having a boy? All those cravings are myths. Those are myths. They are nowhere documented in the medicine books or journals. Common myths in pregnancy. Let's continue asking. Another question comes here. At 20 weeks and my scan was showing that the placenta is too close to the cervix. What should I do? Thank you. Don't worry. If you did a scan and you are told that your placenta is low, there's nothing you can do. What happens? The placenta can attach itself either on the lower side, upper, or on the side. Remember, placenta has its own abnormalities. It can attach itself anywhere inside the uterus. If it attaches in the lower side, we say it increases you at a high risk of having the spotting or bleeding. You just avoid extraneous exercises. From there, we wait until the pregnancy grows. When the pregnancy grows, the uterus expands more. Mostly in other cases, we get that the placenta just escapes from the lower side. It just goes up automatically and then we allow you to go into normal labor. But if you're told that your placenta is on the lower side and you're already you're almost delivering, there is no way you can deliver your baby normally when the placenta is on the lower side. Remember, for you to deliver normally, the head of the baby must be the presenting part or must be the first part down for you to deliver normally. So you don't worry, you just continue taking your iron supplements, continue coming to the clinics and doing the tests according to how we are guiding you. From there, we will come to check to do another scan, that is growth monitoring scan at week 32 to 34. From there, you can be even surprised to seeing that the placenta is no more on the lower side. Does taking Salicra tablet, I don't know which type of tablet is this for calcium. Salicra. Is taking Salicra tablet for calcium good for the baby during pregnancy? Okay, I've not heard of Salicra tablet, but calcium tablets are safe during pregnancy period. Yeah, all calcium tablets are okay. It can be chewable one, it can be soft gel, it can be a tablet that you can swallow, it can be a tablet that you can soak into water and then you take the juicy fluid. As long as it is a calcium tablet, it is safe in pregnancy, and you can check on the leaflet. It has got leaflet. Wow. Any other question? So we are good about the common myths in pregnancy. To summarize, we have said like a certain craving are common myths in pregnancy. About eating for two, it is a common myth in pregnancy. We have said that we increase our eating to from 3 main meals to 4 main meals. Remember, even our stomachs get smaller as the belly grows. So we do the rabbit feeding, especially when we are almost delivering. That is the third trimester. But then you'll find out that you eat very little meal and then you feel you are very comfortable. It's because your stomach has been compressed upwards. But then you can take even 4 meals, 5 meals, just small but frequent. Hydration during pregnancy, let us not forget at least 2 to 3 liters throughout your pregnancy journey. It will ensure that you don't get yourself at risk of urinary tract infection if you are well hydrated. You also don't get unnecessary headache because of poor hydration. You'll find out that good hydration in pregnancy, it will help you to have well hydrated brain tissue. Exercises, we continue. Can I exercise while pregnant? You continue doing normal exercises during pregnancy throughout your pregnancy journey, but not the extraneous exercises. Morning sicknesses, you can even the sicknesses is according to the shifting on the progesterone hormone. So it might not even be in the morning, it can even come, you can have even that sickness even in the middle of the night or in the evening. It is not necessarily in the morning. So we also insisted that you should not skip your antenatal visits. Every month or every visit count. Every time you come for a test, that is every month there is a test for that, or there is a certain checkup for that. Another question comes, I'm almost 23 weeks and my belly is not big. Should I be worried? It looks like I'm 3 months. You should not be worried when you are 23 weeks and your belly is not big. Remember, not all bellies just protrude. Maybe it will come to become bigger in the third trimester. As long as you come to the clinics and you tell you that you are 26 weeks, your midwife will always check on your belly and will tell you, will guide you accordingly. If you are 23 weeks, the scan says that you are 23 weeks, your midwife checks on you, you are 23 weeks, but you feel that your belly is not big. You don't compare your belly with your neighbor's belly. So bellies will grow automatically. So you should not compare yourself with your neighbor. So water makes me puke. Is it wrong for me to always take quencher juice? If there are those people who will take water in pregnancy, but you feel it is making the journey worse. Sometimes we encourage our mothers, if you can add something in that water, let's say like a lemon or like an orange, a quarter of an orange, you can put it in that just to make it palatable, for easier for you to take. You can. Yes, you can. But remember, the quencher juice will not replace the water that we want, but you can just add a quarter of an orange to that water so that it becomes more palatable and can be able to take. Remember, quencher juice, those are unnecessary sugars that you'll get from to your body, but you can add a fruit in that water. I'm 21 weeks and I can't feel the baby move. I can only hear bubbles in the lower stomach. That is very normal. You start feeling bubbling. From there, the movement continues to increase from week 23. Remember, you don't feel the fetal movement mostly when the placenta is attached on the front part. We have said that the placenta can attach anywhere in the uterus. If the placenta is on the front part, that is the anterior. You don't expect to feel the movement. Mostly, either placenta is attached on the anterior part, or maybe it is still too early for you. By week 23, you'll feel the movement. I reassure you. So for now, you are feeling bubbles. That is very much okay. At 26 weeks, my baby is 880 grams. Is it normal? Okay, mostly we expect by between week 24 to 28 weeks, we expect your baby to be at least 1.2 kg, 1 to 1.2 kg. You are 26 weeks, but still at 880. Maybe you are also genetically small. So I can still reassure you, we will do a growth monitoring scan at week 32 to check whether the baby will have hit 1.2 kgs. So for now, we can just chill. We take the normal supplements, normal foods, then we wait. If the baby is small, it will be guided to you on what to do. But for now, I'll continue with the iron supplements, calcium, normal feeding. That is 4 main meals in a day, normal exercise, normal hydration. From there, you'll do another scan at week 2 weeks. You check on the growth. That is the growth monitoring scan, very important scan from week 2, between that 2 weeks to that 4 weeks. So we have answered on why is the first visit so important. We have said it is important because this is a visit that you confirm that you are pregnant. You also confirm that the baby you are carrying is a normal baby. Remember, we have normal babies, we have forced pregnancies. You might be thinking that you're pregnant, but you are not on the test. Normal pregnancy, upon doing the scan, we should get a heartbeat that is regular. That's why it is important. You come, you confirm that you're pregnant. Then we run a lot of series of tests to check on your blood and urine results. So what happens during the first antenatal visit? I answered that one. We do a scan, we do physical exam, we do vital signs monitoring, that is the blood pressure, weight and height, and temperature. We do the blood work, we do the urine checkup, we do the physical exam, we do the running of the danger signs. 40 tests are done. Those ones I said about the blood test and the urine, and we said that you should start your antenatal clinic immediately you miss your period, or immediately you know that you're pregnant. Yeah, we are good. Any other question? Yeah. Okay, please remember to join us for antenatal clinics Monday to Sunday, 8 a.m. to 5 p.m. And remember to join us next for our next live next week on Wednesday between 11 to 12 p.m. Another question comes, I'm at 20 weeks and I haven't started my clinic yet. Am I at risk? Hey, I recommend you to start this clinic soon as possible. You can even come tomorrow. We'll help you out. We'll check on what you have missed instead of delaying this clinic to third trimester, because you're already in the second trimester. You come, you do what you missed in the first trimester, then we'll catch up with you. We'll help you to catch up with those people who are already at 20 weeks. Those who started early enough, we'll help you to catch up with them. You just come tomorrow. We do the clinic. You are at risk. Is it okay to feel on-off pains on the lower abdomen, both on the right and the left side? Why are you feeling this pain? Is it because there is an infection that is not captured? You come, we check on you, we do a physical exam, then we run a urinalysis test, then we check whether you have the urinary tract infection. 13 weeks with 63.87, is that normal? So you are already 63.87 kilograms, I mean. You have written grams. And you are 13 weeks already. So my question is, before you conceived, how many kilograms did you weigh? Because we check on the weight gain from conception until you deliver. So it might be normal if you were 62 kg before you conceived, because we expect you to start gaining slowly until you deliver. I am 29 weeks and I have been feeling nauseous. Why is this? Why are you feeling nauseous? That's 28 weeks. We say in pregnancy, nausea can continue until you deliver, but it should not be worse. From second trimester, it should drop down. It should be at ease. It should not be severe. If you feel nausea, is it severe? If it is not severe, you can do without. If it's severe, you come check. We see how we can help you. But for now, I recommend you eat small but frequent meals, just small. Then take natural fruits. It will help reduce nausea because it has got natural sugars.